IV therapy is heating up the wellness sphere, and Leslie tried out a treatment that claims to help with everything from depression to brain fog. Take a look.
So Leslie, you have you all set up, you've drawn your blood for the testing, and now you have your IV NAD running. How do you feel?
It's only been 5 minutes, and I definitely feel like I've had a few cocktails at the bar.
Everyone feels it within the first few minutes of getting it, and people have different feelings. You'll do experience better sleep. You'll feel lots of improvement in your energy, your mental clarity.
Why are we just hearing about it now in an infusion form?
So NAD is actually a molecule that our mitochondria use to make energy. Our DNA uses for cellular repair. We've known about it forever, but only recently have we been using it IV to, first people use it to treat addiction disorders and PTSD, and now we're using it for health-related reasons over the last few years.
It's pretty controversial because there's not a lot of science.
There's not a lot of big research published studies right now, but there's many going on, and many treatment centers are using it and seeing extremely beneficial effects. But there's also a lot of things just people can do at home to increase their NAD levels.
Such as what?
High intensity intermittent training, fasting, and sleeping 7-8 hours a night. All those things can really help you with your NAD level.
And then what about vitamin B3?
Yeah, so vitamin B3 rich foods such as mushrooms and different kinds of meats can definitely help you get more vitamin B3 in your diet.
Is there any way to test if my NAD is depleted to begin with?
There are tests out there that are just coming out.
So let's say my levels are optimal. Would you still suggest somebody gets a treatment like this?
You know, no one really knows for sure, but if you're feeling low energy, brain fog, it's hard for you to get to sleep at night or wake up in the morning, those are some indications that you might want to try something like this.
Have you seen an uptick of clients that come here with COVID long haul symptoms?
Yes, in combination with lifestyle changes, using some of the therapies that we have here, people are trying that to treat their long-term COVID.
I know there's no guarantees in a lot of medicine, but there's no guarantees with this either that it will help those conditions, correct?
Absolutely, there's no guarantees. So Leslie, you're gonna be here for a couple more hours. I'm gonna let you get the remainder of this infusion, and I can't wait to see you on the show and see how you feel.
I can't wait either.
Dr. Shah, when it comes to IV infusion treatments, you're using other modalities, right? Peptides are part of the program. You talked about NAD. What are some of the other IV infusion things that you like to use?
Some of the IV therapies that we use are, for example, just IV nutrient therapy for people that have nutritional deficiencies. That seems to help a lot of people. NAD is very popular. Glutathione, which is an antioxidant, is very popular as well. So, you know, there's quite a few things out there, but we really try to customize it based on what each patient really needs.
All right, Leslie, how did you do with your NAD infusion?
It makes you feel a little bit nauseous. And so getting through several hours of that was challenging, but I will tell you that the benefit, I have been taking over-the-counter sleep medication for years, every single night without fail. I can't go to sleep without it. I don't know if it's, physiological. I know we've talked about it not being addicting, but every doctor has warned me that chronic use has a risk of dementia. And so in the back of my mind, I've always been concerned about that. I have slept since the NAD infusion every single night, so a week straight without any over-the-counter medicine. And that's why I know this worked, because I had to take it to go to sleep for so long.
Dr. Shah, are Leslie's NAD experiences typical of what you see with other people?
Yeah, I was really smiling when I heard that because I know Leslie's been struggling with her sleep for so long, and it is very typical, actually. It's going to be different for everyone, but I'm seeing a lot of people with better sleep, better energy levels, clearing up the brain fog. It's been a kind of a game changer.
If somebody's interested in potentially NAD infusion, they're not cheap. So what's your advice to people that might want to incorporate this into their wellness routine and maybe don't have the funds for it?
Really, the step 1, 2, 3, and 4 is improve your lifestyle habits, especially in regards to sleep, nutrition, and exercise routines. And then if something like this is something you want to try because that's not getting you to where you want to be, talk to your doctor about it first. And, then do your research. There's all sorts of different prices for these products out there. You want to go to a reputable place that's being run by a physician under a medical license, and do your research and see if you can find someone that's willing to do this for you at a price that you can maybe afford. But it has to start with your lifestyle.